Thanks for watching TMA's Legislative News Hotline for Friday, May 26th. I'm Brent Anier. It's been an intense and emotional week at the Capitol as both houses scramble to vote on a backlog of bills. A couple of bills important to Texas medicine have already been signed into law by the governor, and more are on the way. We will give you a rundown on those shortly. Meanwhile, Tuesday night was the deadline for Senate bills to be heard for the first time on the House general calendar. Some of the bills we've been tracking died without a vote when the clock struck midnight. Several deadlines hit this week for lawmakers to consider local and consent bills, joint resolutions, and adopt conference and committee reports or assign conferees and concur in amendments. Of course, the budget is the only bill lawmakers must pass, and as of this taping, it's still unfinished business. Conferees unveiled their proposal a week ago, and the rumor has it it'll be resolved this weekend. Later, we will ask TMA Vice President of Advocacy Darren Whitehurst for his budget insight. We'll also get a reaction from a physician leader about the budget cuts to public health, and lawmakers pay tribute to a former TMA president and pioneer in medicine in South Texas. But first, TMA priority bills take their last big step. Governor Greg Abbott on Tuesday signed Senate Bill 507 into law. The TMA priority bill by Senator Kelly Hancock of North Richland Hills and Representative John Frullo of Lubbock will expand the billing mediation process to all physicians and those providing out-of-network services at certain in-network facilities. It also expands mediation to out-of-network situations for emergency care. The law takes effect on September 1st. Also Tuesday, Governor Abbott signed the TMA-supported Step Therapy Override Measure, Senate Bill 680, also by Senator Hancock. The bill empowers physicians to override health plans' step therapy protocols, instead to continue prescribing an effective medication even if the insurer's step therapy plan calls for a medication change. The new law also takes effect on September 1st. More bills are headed to Governor Abbott's desk for his approval. The Senate on Wednesday gave final approval to House Bill 1600 by Representative Symphonia Thompson of Houston, which would allow Medicaid to pay physicians to conduct mental health screenings during each annual well-child exam. Currently, Medicaid procedure codes for this screening may be used only once in the adolescent patient's lifetime. The bill heads to Governor Abbott's desk. And lawmakers also finally passed House Bill 1917 by Representative Richard Raymond of Laredo to keep the Medicaid preferred drug list under Health and Human Services Commission oversight. HHSC will manage the PDL until 2023, and then managed care organizations would take over. That bill heads to the governor's desk as well. The bill's Senate sponsor is Senator Dr. Charles Schwertner of Georgetown. And late this week, several more bills of interest finally passed and should head to the governor's desk too. Those include House Bill 62, the statewide texting ban bill by Representative Tom Craddock of Midland and Senator Judith Zaffarini of Laredo, House Bill 2466 by Representative Sarah Davis of West University Place and Senator Joan Huffman of Houston, allowing children's Medicaid and CHIP to cover maternal depression screening for an enrolled child's mother during a covered well baby visit or to a pediatrician or other pediatric provider. House Bill 3576 by Representative Bobby Guerra of McAllen to shore up the state's testing and screening capabilities for infectious diseases like Zika. And Senate Bill 1066 by Senator Dr. Schwertner, which requires new medical schools to offer new graduate medical education positions to keep pace with their medical graduates. Lawmakers successfully amended the Prescription Drug Monitoring Program, PDMP, revamp proposal onto another bill, and it finally passed too. So House Bill 2561 by Representative Thompson with the PDMP language will head to the governor as well. The original PDMP bill died. And the bill to allow DSHS to post signs banning guns in Texas's 10 state mental health hospitals died as well, but was amended onto another bill, which also received final passage today. So House Bill 435 by Representative Ken King of Canadian goes to the governor next, too. Meanwhile, other bills important to medicine advanced this week. First, good news and bad news about the Maintenance of Certification bill. The House passed Senate Bill 1148 by Senator Dr. Don Buckingham of Lakeway this week, but they amended the bill to remove hospitals, so health facilities could still use MOC status to differentiate among physicians for payment, contracting, and credentialing. Late Thursday, the Senate said no to the amendments and appointed conferees to meet with House conferees to try to reach a compromise. The Senate conferees include Dr. Senators Buckingham, Schwertner, and Donna Campbell, as well as Senators Van Taylor and Chuy Hinojosa. The House conferees are Dr. Representatives Greg Bonin, Tom Oliverson, and John Zerwas, and Representatives For Price and Garnet Coleman. The Senate passed House Bill 3124 by Representative Lance Gooden of Terrell, which would allow doctors in physician-led accountable care organizations to receive and share physician-specific comparison data and information. However, senators added several non-germane and likely controversial amendments. The House must concur with those amendments or seek a conference committee to resolve the differences. The Senate also approved House Bill 3576 by Representative Bobby Guerra of McAllen to shore up the state's testing and screening capabilities for infectious diseases such as the Zika virus. The House must agree to the Senate amendments or seek a conference committee. Wednesday, the House gave its final approval to Senate Bill 224, Senator Kirk Watson of Austin's Cancer Prevention Research Institute of Texas, or CPRIT, sunset bill. The bill extends the sunset date of the organization from 2021 to 2023, while also adding 2 years to its eligibility to allocate funds to 2022. Now the Senate can either concur for final passage or seek a conference committee to strike a compromise. Also on Wednesday, the House also finally passed the bill to continue the Maternal Mortality and Morbidity Task Force at the Department of State Health Services. Senate Bill 1929 by Senator Lois Kolkhorst of Brenham extends the task force, which is helping the state identify the causes of Texas's high and growing rates of maternal mortality and morbidity. The Senate must either agree to the amendments or seek a conference committee to try and strike an accord. But the budget is a top priority as the end of the session countdown continues. The Senate unanimously passed the supplemental budget bill for the current 2-year cycle this week. House Bill 2 totals $2.6 billion. The bill adds about $800 million in state funds plus $1.6 billion in federal funds to cover the current budget's Medicaid shortfall. The bill also includes another $158 million in combined state-federal funds for the Texas Department of Family and Protective Services, largely to hire new Child Protective Services caseworkers. HB 2 also would cover repairs at state mental hospitals, as well as gaps in public education and the state teachers' pension program. The House must give final approval, then it's on to the governor. Again, that's the current budget patch. As we mentioned, we hear rumblings about a budget deal for the next biennium. This was the colorful description a few days ago announcing a deal by Budget Conference Committee co-chair Senator Jane Nelson. So we asked Darren Whitehurst, TMA's Vice President of Advocacy, for the latest on the budget. We appreciate Darren joining us today to talk about the budget. Know it's been at the end of the session, long hours, long days. We appreciate all you've done to work on this. And thank you for coming in to talk about the budget. We know it's a lean budget year. How did medicine fare?
Well, great, Brent. I appreciate the opportunity. It has been a very hectic week, and I have my handy-dandy phone here just in case got a member calling at the last minute. Like you said, it was a lean budget year. Overall, I think that Chairman Nelson and Chair Zerwas did a good job delivering a budget that makes sense for the state. It is about $217 billion all funds, about $107 billion in general revenue, and about $1 billion in rainy day funds. So they used some rainy day funds this session to try and make the budget whole. You know, medicine, I would, if I were giving it a grade, I would probably say maybe a B-. Some things that we wanted that didn't happen. But you know, overall, I think that there were some really good things that came out of this budget, and certainly we're able to try and shepherd through things like Medicaid and get them in a good position at the end of the day.
Knowing how things began this session, I guess a B- isn't so bad.
That's right.
So let's break it down a little bit. Medicaid, you want to talk about that
Medicaid,
first?
You know, so overall, you know, Medicaid is the largest single budget item in the state budget. There was a cost containment rider. There has been for the last several budgets. This one totaled about $427 million. It is unclear what some of the impact is. It's still early. We're going to have to work with the Health and Human Services Commission to actually figure out the things that are going to be targeted and how to make sure that they don't impact either the providers or the patients that they care for. The rider, probably the largest single cost savings deal in that rider, related to the Medicaid managed care companies, and basically looked at their risk margins, and the legislature basically said they're looking to save about $77 million out of that. So, we're going to be closely watching that, have some concerns about it, but want to make sure that that is done correctly and that it has the least impact possible on providers and the patients that they care for. The rider that was in one of the original versions relating to $1 billion federal flexibility on the Medicaid side ended up being taken out. So don't have to worry about that for right now, but we will be watching very closely and be actively involved with the Health and Human Services Commission as they move forward in determining how Medicaid funds are going to be allocated this next 2-year period.
Wonderful. So yes, as you said, that's the lion's share in terms of medicine, but then women's and children's health is very important to our physicians.
Well, and overall the funding is fairly stable in that area. Not big increases, but not cuts as well. That there was a rider that was put in that basically looked at several years ago. The state opted out of federal participation in women's health services, and it was a 90% federal match, 10% state match. So basically the rider asked the state to pursue an 1115 waiver with the federal government to try and re-engage on that deal and get the federal government to help pay for our women's health services. And I'll just keep on moving on the mental health front. That was where a good portion of the rainy day funding, basically the caveat on the use of rainy day funds is that the Senate in particular, but both chambers really didn't want those funds to be used for recurring expenses for the state. So they really wanted them focused on one-time expenditures, and a bunch of those ended up happening on the mental health side. They allocated basically almost $450 million, maybe a little bit over the $450 million mark, to improve the facilities. And if you've ever been out to one of the state facilities, they are in desperate need of repairs, and so they allocated almost $500 million to improving those facilities. The legislature also targeted mental health services as a priority, and we'll talk, I'm sure, in the future about some of the pieces of legislation that passed on the mental health front, but there was funding that went along with that, almost $150 million in additional funding for community-based programs. So again, a mixed bag on those things related to on the Medicaid side and maternal health and mental health. Finally, on the public health front. Right. I think that is an area of concern, still is an area of concern. Probably the area that saw cuts, fairly significant cuts, was on the public health side. On the positive note, they did give the agency additional flexibility, but we saw cuts on the lab services that are provided by DSHS. We also saw cuts on disease prevention in areas like AIDS and HIV funding, children with special health care needs, immunizations, and infectious diseases. And basically all of those saw about 10% less than they had the previous biennium. So we're going to be keeping a close eye on that, going to be working with the commissioner, making sure that the needs of the state are addressed moving forward, and that, again, we are certainly want to be vigilant relating to our public health infrastructure.
The thing, we had the advent of Zika in Texas, and certainly the threat of it again. And so do these cuts affect the potential for the state to respond to a situation like that?
Well, again, is that our Legislative Budget Board has authority to go in. We have funding that's available. Again, you want to make sure that you're prepared. Again, between the DSHS commissioner as well as the HHSC commissioner, there is flexibility to move money around. And so, again, I'm optimistic that for the next 2-year period, we've done enough to make sure that we may not get over the finish line by a whole lot, but I'm optimistic that we'll be able to meet the needs of the state, and that if we have a public health disaster, an outbreak somewhere, that we will manage to get through it. So
they know what needs to be done.
That's right. That's right.
Right. Do you want to move on to graduate medical education?
Yeah, that'd be great. So on the GME front, I think that certainly is a bright, shining example of where, the legislature, despite the fact that it didn't have a whole lot of money, recognized the importance of GME, had a lot of advocacy on that behalf, and ended up putting about $44 million in additional residency slot expansion, which will allow us, we made considerable gains last session, and since most residencies are not a two-year cycle, but are 3 and 4 and 5, will allow us to continue the gains that were made last legislative session on that front. There were also some slight increases on the formula funding side that, again, will be beneficial for those existing slots that we have. Sort of on the downside, and there's always a downside in these lean years, things like the family medicine residency program saw a cut, and then the physician loan repayment program saw a significant cut. But again, is that we will be working to try and make sure that those types of programs in the future, that we're able to get money back into those programs, and we'll continue to advocate on their behalf.
I know for at least a couple of sessions, we've pushed for the 1.1 to 1 ratio. We didn't quite maintain that then?
Didn't quite. There was actually some legislation that related to trying to make sure that as we're looking at bringing potentially new medical schools online, want to make sure that there's an accounting and that these schools that are coming online are as invested in graduate medical education as they are in undergraduate medical education. So I think that's a very positive thing. The last thing that I'll mention is that there were some issues relating to some specific riders, and they related to the employees' retirement system, one of which would have reduced the payments to the health-related institutions and set the rate in rider that they would only be paid Medicare rates for the services that they provided to ERS employees. That rider was taken out. As it specified HRIs, the savings are still in there, and so again, we're going to be watching very closely what ERS does and how they move forward. The other rider that they had increased the patient's out-of-pocket responsibility if they went to a out-of-network freestanding ER. That rider was left in there, and again, is that we believe is that probably should have applied to all out-of-network ERs and not singled out the freestanding ERs, but the rider language is what was adopted, and it's specific to the freestanding ERs, and so those that are out-of-network, potentially will see the patient has increased responsibility relating to going to one of those out-of-network facilities in the future.
Okay, great. Is there anything else about the budget that you would like to touch on?
Well, my mind is mush right now, and again, is that we basically have gotten the report really within the last couple of days, and so we're still digesting what the report, what the conference committee report says, what the specifics are, and so some of the details will change moving forward into the future, and so I may be coming back and apologizing and say I told you one thing and actually really meant another. We'll find it as we scour through the budget. The budget is only about yay thick, so it doesn't take very long to get through it. But I've appreciated all the support. The first Tuesdays were a great example of what doctors coming and advocating on behalf of medicine can do in the legislative process, and I think that their involvement made a tremendous difference of where we started and where we ended up. And it was because of the advocacy efforts that we have a much better budget document for the physicians and the people that they take care of than we had at the start. So I have had my team put forth a whole lot of work and effort. The county medical societies, and we had specialty societies, and again, it was a team effort to get to where we are.
Well, we appreciate all that you and your team have done this session on behalf of physicians in medicine, and we'll talk again really soon.
Great. Thank you, Brent.
Thank you. We appreciate Darren's insight. And yes, public health spending is a major target in a lean budget. Physician experts tell us the entire population is at risk if you cut spending on infectious disease prevention and surveillance, tobacco and chronic disease prevention, and emergency preparedness.
We've really got to recognize this state continues to grow. We're becoming more and more populated. The risks are growing, so the threats around the world are growing. You can now arrive in a major city in Texas in a matter of hours, being from anywhere else around the world. And we have to be prepared for the inevitable new infectious disease threat, but at the same time, we're reducing our funding for public health readiness in this state. And so that's what I'm concerned about.
With just a few days left in the session, we'll keep you posted on final developments. But we want to close today with a special legislative tribute to a former TMA physician leader, Dr. Mario Ramirez. Dr. Ramirez passed away last Monday at the age of 91 at his home. He was the first Hispanic TMA member to serve as TMA president from 1979 to 1980, and he was a TMA Distinguished Service Award recipient. South Texas lawmakers honored Dr. Ramirez on the Senate floor this past week for his work to bring health care and medical education to the Rio Grande Valley.
He took every opportunity to champion the needs of medically underserved Texans, serving on the boards of numerous state and national medical organizations, including as the first Hispanic president of the Texas Medical Association. 4 United States presidents, Johnson, Nixon, Carter, and Bush, honored him for his professional leadership.
He was what I consider an old school doctor, Dr. Schwarter, in that he would make house calls, carrying his black medical bag, and old school in that respect, but also he was an icon, had a great vision, because he knew that in South Texas, not only were we underserved, but it was one of the poorest areas in the country. So he dedicated his life in trying to find ways to improve health care.
When we needed anything that dealt with medical education, healthcare services, we turned to Dr. Ramirez. He was an example of a true civic leader and a loving family man.
Dr. Ramirez founded the first family practice center in his hometown of Roma in the Valley in 1950. He later established the first hospital there. He served as Starr County judge, and he helped open the Starr County Memorial Hospital in Rio Grande City. He later served on the University of Texas Board of Regents and as vice president of the UT Health Science Center at San Antonio. That's it for this week. I'm TMA's Brent Inier. Thank you for watching, and please join us again next time for a session wrap-up on TMA's Legislative News Hotline.